Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. Nice to meet you. My name is Paula Patron, and I'm 29 years.
Okay, how may I address you?
Please call me Paula.
Okay, Mrs. Paula, today we are going to discuss about your health issues. Is that all right with you?
Okay, doctor.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it all right?
Okay, doctor. I have no problem with that.
Okay, now Mrs. Paula, can you please tell me in your own words what have brought you here?
Doctor, for the last couple of months, I am noticing that I have some headache, and that actually was so boring headache. And previously, I was diagnosed with migraine, and for the last 7 years, I am having medication for that when I feel the migraine pain. But this time, this headache is somewhat boring and somewhat bothersome for me. So I thought that it might be a variety of migraine. I took the paracetamol. Initially, it helped me a little, but now it is not working at all. And then I visited my GP. He didn't find anything abnormal, and he suspected that this can be somewhat other than the migraine. So he sent me here.
Okay, and can you, I will try my level best to find out what's bothering you. Can you please tell me exactly when it started, how much time back?
It would be around 3 months, doctor.
3 months. Okay. Can you remember that did it come along suddenly or gradually?
Gradually, it is increasing gradually day by day.
It's
Initially, it
increasing
was boring.
gradually. Okay. You told that initially it was boring, and can you please tell me how is it now? This
It
headache?
is somewhat, doctor. It is also boring, and I feel that I have headache all over my head. I don't feel anything, just like not like migraine. Somewhat different. I cannot express how it is feeling.
Oh,
It's somewhat like something pressing over my head.
something please. Okay. Can you please tell me that is it confined to any part of your head or whole head?
Whole head, doctor, all over the head.
All over the head. Okay. And can you tell when once it starts this headache? Can you please tell me how long does this persist?
It is present all over the day, doctor. But as the day progresses, I feel somewhat better.
Okay. And is there any specific time of the day when it's worse or
In the
better?
morning,
You
what's in the
told that
morning?
in the morning. Okay. And have you noticed anything that makes you better apart from evening?
No.
Okay. Anything that makes it worse, like coughing or something else like that?
Yes, doctor.
Bending forward.
Yes, doctor. That also, I think that give me so much discomfort.
Okay. And okay. And may I ask you some other questions now? That okay. That do you have any problems in your vision recently or any time?
Yes, doctor. I
Can you
used
please tell me more
spectacles
about it?
before. I used spectacles before, but this time I am not seeing clearly even with my spectacles. I changed my spectacles 2 times in the last 3 months, but even my vision is
Okay.
not clear.
Okay. Can you please specify that which part of your vision is more problematic? It's a central part, or where do you bump into objects? Can you please specify what happens?
I haven't bumped into object, but I feel that it is hazy. My vision is hazy, not any specific part, but overall it is hazy.
Is it heavy all the time, or does it get better at times?
It's more or less all the time.
More or less all the time. Okay. And do you feel any pain in your
No,
eyes?
no,
Any redness?
no,
Any double vision?
no,
Okay. And did you have any raised temperature recently?
no,
Okay. Any problems with your speech?
no,
Okay. Any problems in swallowing
no,
food?
no.
Okay. And any okay. And any vomiting? Have you noticed?
I feel the feeling of throwing up, but I never vomited.
Okay. You didn't vomit, but you felt like vomiting.
Yes,
Is it right?
yes.
Okay. Okay. And when does this occur?
It's in the morning.
Okay, in the morning. Okay, that's all. And okay, and have you ever felt weak in any parts of your body?
No.
Any abnormal sensation in any parts of your body?
No.
Any stiffness in your neck? Any tightness in your neck? Have you noticed?
No.
Okay, and uh, have you had? You told that 3 months back you started this headache. May I know that did you had any accident or any trauma to your head around that time?
No.
Okay, have you ever lost consciousness during this period?
No.
Okay, and any? May I ask you now that do you have any raised temperature? You told no, and any loss of your weight? Have you noticed?
No, doctor.
Okay, that's all. And any weather preference?
No.
Okay, any lumps and bumps anywhere in your body?
No.
Okay. Any joint pain? Have you noticed?
No.
Okay. Any rashes anywhere in your body?
Not rashes, but I have acne for a long time.
Oh, that's all right. And can you please tell me more that uh, when what was it diagnosed this acne?
I am suffering from this for last 3 years, and it is not curable with anything.
Okay. And for 3 years, so I presume that you take some medications for it. Can you
Yes,
please
doctor.
specify which medication do you take? Can you remember? It's not a
Doctor,
burden. Please.
doctor gave me antibiotics called tetracycline and another
Okay.
cream that is called tretinoin cream.
Okay. Okay. That's all right. And for how long have you been taking this?
Last 3 months.
Okay, for 3 months. Okay, that's all right. And can you remember about the dose of this tetracycline or retinoid? Can you remember?
No.
Okay, that's all right. Please don't get bothered. Okay. Okay. Now, can I ask you some more questions now? That do you have any soreness in your mouth?
No.
Okay. Any soreness anywhere in your body?
No.
Anywhere else?
No.
Okay. And do you have any cough?
No.
Any chest pain?
No.
Any racing and pacing of your heart?
No.
Any chest tightness?
No.
Any noisy chest?
No.
Okay. And do you have any nasal stuffiness? Have you ever
No.
noticed?
No. No.
Okay. And okay. And may I know that uh, have you ever coughed up blood?
No.
Okay. And have you ever what about your water work? Is it all right?
Yes, doctor.
Okay. Have you ever noticed any frothiness in your water work?
No.
Any blood ever in your water work?
No.
Any pain while doing your water work?
No.
Okay. And how about your bowel movements?
I think it's fine.
It's fine. Okay. And have you ever passed out blood?
No.
Okay. And may I know that have you ever passed out blood through any other of your body parts?
No.
Okay. Okay. And may I ask you some other questions now? That do you have any other known disease other than your this migraine?
No.
Okay. And have you ever checked your blood pressure level or blood sugar level?
Yes, doctor. That was quite normal. Even my GP have tested that.
Okay. Okay. That's all right. And Mel, just may I ask you that do you have anyone in your family with such type of symptoms? Do you know
No.
any history of? I'm sorry to ask, but may I ask that is there any history of cancer in your family?
No.
Okay, and any history of a sudden death in your family?
No.
Okay, and you told that you have been taking tetracycline and retinoid. I reckon that you also take some medication for your migraine. Am I right?
Yes, doctor. I took paracetamol.
Yes, and uh, well, have you ever? I'm sorry to ask, but have you ever taken any intentional overdose of any of these medications?
No.
Okay, that's all right. And any allergy to any medication?
No.
Any over-the-counter medication?
No.
Any herbal medication?
No.
Okay. And have you ever taken any medication through your blood or any blood transfusion?
No.
Okay, that's all right. I'm sorry to ask. Now if you allow, I'm going to ask you some personal questions. Will it be all
Okay,
right?
doctor. Okay.
Okay. Have you ever taken any recreational medication?
No, never.
Well, that's very appreciable. Do you smoke,
Yes,
Miss
doctor.
Paula? How many sticks for how long?
About 10 sticks a day for last 10 years.
Okay, actually, smoking is very harmful, and actually, your symptoms can be related to smoking also. Okay, so I would I would refer, I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Will it be all right?
Okay, doctor.
Okay. And do you drink alcohol?
Occasionally.
Okay. Have you ever had any binge drinking?
No.
Okay, that's very good. And now, may I again ask you some personal questions, if you allow?
Okay.
Okay. And may I know that are you living alone or do you have a partner?
Yes, I am living with my husband.
Okay. And it's again a personal question, but may I know that how is your period?
I think it has recently somewhat changed a little, not so regular.
Not so regular.
Yes.
Okay. For how long have you been noticing it?
For last 6 months.
For last 6 months. Okay. And okay. And uh, okay. And have you ever tried to have a baby?
No.
Okay. And do you take any medication for not conceiving?
Yes.
Okay. Well, and you actually take some medication for your acne. Have you been advised uh, regarding your uh, regarding your married life about
Yes, doctor.
how while taking the medication?
That
Okay.
doctor said to take extra protection. I am taking some pill and also my husband using condom.
Okay, that's all. That's all right. And may I know that have you been to travel to any country recently?
No.
Okay. And may I know that you drive?
Yes, doctor.
Okay. Okay. And okay. And actually, since you are having some problem with your vision, I advise you that it's better to stop driving for a while as long as we make the diagnosis. Will it be all right?
Okay, doctor.
Okay. And may I know that what do you do for a living?
I'm working for a private company.
Okay. And how is this headache affecting your job life?
I 2 years remaining.
Okay.
Or
How is your
I have to do some paperwork and I have to a long time look into the a monitor of computers. So this is somewhat difficult for me.
okay, okay. And if you want, we will refer you to the occupational health service so that they can help you out a bit more in this matter. Will it be all okay?
Okay, doctor.
Okay. And well, at this point, Mrs. Paula, can I please know what is your concern?
Why I am having this, doctor? What?
Okay. Uh, okay. And actually, at this moment, I have to examine you thoroughly, and also examine you thoroughly and uh, do some investigation, do some tests as well. But as long as I have taken history, I think that you might be suffering from a condition named idiopathic intracranial hypertension. Have you ever heard of it?
No.
Okay, please don't bother about the term. It's actually a condition in that might be caused by some medication as well. And I fear that the medication that you take for your acne, named tetracycline, this might be causing these problems. Okay. However, we have to be sure by making tests and doing investigations. We will involve nerve doctor, uh, the nerve doctor, and also medicine specialists, and also our occupational health service in this matter. And and at the say, we will also advise you to stop smoking, and we will actually review your medication again, so that we can shift to any other medication for your problems. And and the occupational health service can also help you with your job. And do you have any more concern, Mrs. Paula?
Time up.
Okay. Okay. And well, examination. Actually, I would like to do some examinations for this patient.
Proceed.
Okay. Uh, okay. At the beginning, I would like to check. I would like to check her pulse.
72 beats per minute.
Okay. And then I would like to have a look at his head, whether there is any scratch mark or any trauma present or
No.
not. Okay, and then I would like to test his vision, his visual acuity. Is this all right?
Visual acuity is reduced.
Okay, and visual field of vision.
Intact.
Okay, and then ophthalmoplegia. Any ophthalmoplegia present?
No.
Okay, and color vision is okay, I think. And then I would also like to go for fundoscopy of the patient.
You don't have time for that.
Sorry.
You don't have time for that. Proceed further.
Okay, okay. And then I would like to look at his precordium and feel his heart,
Okay.
heart sound,
Normal sound.
normal sound. Okay, and then I would like to check her knee jerk and also plantar.
Plantar flexor.
Okay, and knee jerk
Present.
present. Okay, and I think that's all.
Okay. So have you reached your diagnosis?
Uh, well, I think the patient is suffering from idiopathic intracranial hypertension. I think so.
Okay. And do you have any alternative diagnosis?
Um, Alternative, I think this can also be uh, any intracranial space occupying lesion as well, ICSOL, and uh, ICSOL, and I think I cannot remember now. Sorry.
Can it be a case of medication over you said?
Yes, it can be.
Okay. Can it be a case of tension type headache?
Yes, tension type. Okay. Yes, that can also be a problem.
Okay. So how do you like to investigate her?
Uh, Investigate at the beginning. I would like to do some routine blood tests like corpuscle blood counts to see any anemia present or not, or any signs of inflammation or infection by neutrophil count and also ESR and CRP level. And then I would like to do some CT scan or MRI of his brain. Okay. Hello.
Yes. What do you expect on that?
Uh, Actually, on CT scan, I think it will be quite normal in this patient. If I think idiopathic intracranial hypertension. Okay.
Okay.
And then I would like to go for ECG, chest X-ray PA view, and echocardiograph. And I would also, very importantly, I will have to do lumbar puncture. Okay.
What do you expect on the
After
lumbar?
doing on the lumbar puncture, I would expect increased opening pressure in this patient. Okay. And increased opening pressure, I think.
Fine.
Okay. And I think these are the main investigations I would like to do.
Do you like to do the thyroid function test?
Yeah, I would like to do, because she has some problem with her menses, so that will be important.
Okay, fine. So, how would you like to manage her? Suppose this is a case of idiopathic intracranial hypertension.
Yes, in idiopathic intracranial hypertension, first of all, I would have to educate the patient, education and counseling about the diagnosis, and then I would like to actually in this patient I would like to form a multidisciplinary team involving the neurologist and a medicine specialist to review her medication, whether to continue with this drug or not, and also I might also uh, for I cannot totally remember at this point, but I might need repeated lumbar puncture for this patient, but I am not totally sure. I've actually a bit at a loss for forgotten.
Okay, so you think that this is a multidisciplinary approach?
Yes.
So first of all, you want to involve the neurologist,
medicine specialist, occupational health specialist.
okay, occupational therapist, and also dermatologist for acne drug medication review, right?
Yeah.
Do you
Sorry,
think
I just
the
totally forgot.
gynecologist review should be taken?
Yes, I think so.
For what?
I'm sorry to tell. Actually, there are some more specialists should be involved. Dermatologist, endocrinologist, gynecologist should also be involved
What is the role of
in this patient.
gynecologist in this case?
The important case is actually she has been taking retinoid. Sometimes tetracycline retinoid both can be involved in this intracranial idiopathic hypertension. So that is an issue. And again, if she is trying to have a baby or not, if she's willing to, then it can be very important for the gynecologist to review the medication as well.
Any other review should be taken by the gynecologist?
Yes, she told about her irregular menses. Actually, that is also very important for the gynecologist review.
Any other thing do you think that she should?
Uh, well, I cannot remember now.
Okay, oral contraceptive pill can also be a cause of intracranial hypertension, so
Yeah,
that
yeah, 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 yeah,
that
yeah,
also
yeah,
be
yeah,
good. And, do you
yeah,
think
yeah, yeah.
any other important uh, uh, specialist or any other important measures or any other part of any member,
Uh,
any important member that should take their opinion should be taken?
I cannot remember. I'm sorry, actually.
Do you think the dietitian advice is necessary?
Yes, yes, yes.
Can you explain why?
Uh, Dietitian advice. I cannot. I just cannot remember. Can you help me out?
Actually, idiopathic intracranial hypertension is also related to obesity. So, weight reduction is an important measures of treatment.
Mhm. Yeah, 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 yeah. That was very important.
And also ophthalmologist review.
Yeah, yeah.
Yeah, do you know any drug that can reduce intracranial hypertension? Any medication?
Medication. I think steroid
I think steroid causes
also
intracranial
precipitates.
hypertension.
Yeah, actually, yeah. Actually, precipitates. Uh, Idiopathic internal hypertension. I'm not sure. Mannitol can do. I'm not sure. I've forgotten actually.
Actually, there are certain medication like acetazolamide.
Acetazolamide. Sorry, acetazolamide. I just forgot acetazolamide, but it can take time actually. Okay.
Okay, so fine, thank you.
Okay.
So, in this case, actually, I think you should have trust a few points more. And
Okay.
actually, you tasked all those in previous session. I don't know what happened to you in this case. For pain,
Okay.
you haven't go for the Socrates. You haven't asked clearly what is the site I have taken. I have told it voluntarily.
Mhm.
Then onset, you have asked it
Mhm.
well. Then you haven't asked about the frequency, if it is
Mhm.
every day or if it is episodic. If there is any good time and bad time, you haven't asked
Mhm.
about anything.
Mhm.
This
Mhm.
pain was progress. The pain was present every day.
Mhm.
Okay.
Yeah.
Character of this pain you haven't asked it. It was dull aching pain.
Yeah. But she actually repeatedly told there's a Dalek, so
Yeah.
I didn't
But
ask it.
you should have get totally that what was the feeling of his pain. You haven't asked
Okay.
it.
Okay.
So she was telling about her feeling. There could be something different if you asked it in a by specific way. Then
Okay.
radiation you haven't asked that does this pain go anywhere else?
Yeah. Yeah. Yeah.
Then for
Yeah.
associated
I missed very many points actually at the time. Yeah.
and for associated symptoms, you have done well for neurological symptoms like, but you should have asked about any tenderness in the head, anything.
Yeah. For
You have
GC.
asked about any. You have asked about any changes in the vision, any changes in the color of eyes, any weakness, any tingling sensation, any numbness sensation, any neurological signs. That was fine. Then priming, you have asked this is more in the morning, and eliciting or aggravating factor, you should have asked more about that. That lying down also increases the pain and causes more discomfort. If you asked it in a specific way, I should have told that yes, lying down is somewhat problematic for me.
Yeah, yeah.
I feel more pressure on my head at that time. Relieving factor, sitting down or standing, that give me some relief. And yet, when asked about the severity,
Yes.
was
I forgot many,
is
many, many
score of
points
the
there.
pain.
Yeah.
And after that, you have tried to rule out other causes of headache, like any recent meningitis, any infection,
Mm,
migraine.
mm, mm,
As this patient have told about migraine, you should have asked more little bit about that. Where when you feel the migraine, where do you feel the pain? For how long it persists? What, how many medication or how many tablets do you need to take? And at what
mm,
level or at what dose do you take this medication? Patient may take
mm,
paracetamol for last 3 months all the day. That is, she is
mm, mm,
suppose 3 or 4 gram tablets each day.
mm, mm, mm.
You should have asked about that. That is, so that you could have ruled out that it is not a medication over you said.
Yeah, yeah, yeah.
Okay.
Yes.
And also for the attention type headache, that also increases more at night. That is band like sensation, band like pain.
Mhm.
You have
Mhm.
asked for that, then it would be better. Then past history, that was fine. You should have a little bit asked more about the migraine this time. Then
Yeah.
medication history, you have went for that well, but I think you should have asked about more about the doses.
Migraine.
What is this or
Migraine.
how
Yes.
many
Really
tablets?
migraine.
How many? Yes, how many
Mm.
tablets does it take? Any other medication? Does have you ever tried?
Mhm. Yes. Yes.
After that, also family history. You have asked that, but that was somewhat haphazard. You have asked family history first, then you have went for the past history.
Mm.
In
Mm.
the personal history, you have asked almost everything. I have nothing,
Yes.
smoking, alcohol, everything. Job, that was fine. And
Yeah.
how support, any financial support, any economic support, that was actually
Yeah.
fine.
Yeah.
Okay. And in the differential diagnosis, that I expected that you should take more, you should tell, or you tell more that that is called differential diagnosis.
Yeah. Yeah. I should have told this at the very quickly. I actually
Yes.
forgot.
And yes, you have suspected this is a case of idiopathic intracranial hypertension. You should have ruled out all the causes of idiopathic intracranial hypertension or uh, risk factors of idiopathic intracranial hypertension. You have asked about the weight, any weight changes.
Yeah.
You have asked about her weight, regular weight. This is a surrogate.
Mhm.
So you should have asked
Mhm.
about the regular weight. What was the regular
Mhm.
weight of
Mhm.
her? Okay.
Mhm. Mhm.
All the medications you should have told about that I am going to review all the medications,
Mhm.
including
Yeah.
contraceptive pill, tetracycline,
Mhm.
isotretinoin.
Yes. 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 Okay.
Overall, this was fine.
This is medium. Actually, I forgot a little bit a lot. Actually, during the Socrates, I couldn't. I just forgot. Okay.
Yeah, maybe next time you will do much better than this.
Yeah. 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 Okay. The thing is that I thought that I was asking, but somehow I I didn't. This didn't came out through my mouth. I just even while asking the questions, I was thinking that I was asking Socrates, but actually I missed so many points.
Yeah.
That happened. Okay. Okay.
Okay. Can you tell me the red flag signs for neurological or headache?
Yeah, it's a new onset headache after I think 55 years of age, worst ever headache with any neurological symptoms, headache with seizure, and then I think headache, thunderclap headache, worst ever headache, and I think these are weight loss. Any history of malignancy, I think these are important, and any history of trauma or accident.
Oh, fine. Thank you.
Okay, okay.